doctors know when to prescribe you certain types of antibiotics? I'm a dental hygiene student. Let's talk about it. First up, let's talk about the microbiology background of bacterial infections. Stage 1, the initial infection. You're going to have gram-positive cocci. For this, the drug of choice would be penicillin or amoxicillin. However, if people have a penicillin allergy, you would want to give them erythromycin or clindamycin. So penicillin structure looks like this. It is a beta-lactam ring, which is also similar to cephalosporins, which is why you can't give somebody who's allergic to penicillin cephalosporin. This is erythromycin, this is azithromycin, and this is clindamycin. Penicillin and the cephalosporins have the same structures, which is why you can't give people who are allergic to penicillin cephalosporins. So you have to go to the other ones that don't have the same structure, okay? Do you also notice how they all end in mycin? Moving on to stage 2. This is a mixed infection. There's going to be both positive and negative cocci. So because it has both, you can use the penicillin, amoxicillin, or erythromycin, or clindamycin. But because it also has negative, you have to use metronidazole, I don't know if I'm saying that right, or clindamycin. Clindamycin treats both gram-positive and negative cocci anaerobes. The stage 3, this is the advanced infection. This is going to be predominantly negative bacteria. So this is when you would only use the metronidazole and clindamycin. I'm sure you hear all the time about how important it is to finish the bottle of antibiotics, even if you feel better, because our bodies or the bacteria can become resistant. This is when our bodies can have a supra-infection. It can also be caused when an original infection is used by broad-spectrum antibiotics. So now the good and the bad are destroyed. Let's talk about some more vocabulary. So we have bactericidal. That means it kills the bacteria. It makes it irreversible. Then we have bacteriostatic. This basically inhibits the bacteria or makes it slow the multiplication, okay? Whenever you see the word static, it means slow or not good, just kind of like, eh. The growth of bacteria is reversible, so it's not a bactericidal, it's a bacteriostatic. Virulence, disease-producing microorganism. I think of the word of virule, rule, the kingdom, microorganism, kingdom. They have the power, that's it. Inoculum is number of organisms present. Let's talk about some antibiotic tips, okay? Penicillin has the highest incidence of allergies. The most common allergic reaction to penicillin is a rash, or if it's severe, it can be anaphylactic shock. Most common allergic reaction with any antibiotic is a rash, by the way. Some antibiotics can decrease the effect of birth control, so be careful when you take your birth control and antibiotics. Antibiotics can also increase the effects of anticoagulants such as warfarin. So if it has a K, always be careful too. Like penicillin VK, the vitamin K, it helps it absorb better, but just be careful. Erythromycin has the highest GI complaints, poopy issues. Clindamycin, however, can lead to pseudomembranous colitis, which is C. diff. So be careful. Severe, persistent diarrhea that can make you go to the hospital. Nurses know about this one. Tetracycline is contraindicated during pregnancy and children under 8 years old. Cause tetracycline stains on the teeth with discoloration. Liquid forms of antibiotics have a high sugar content, so if you're a child and you have to take antibiotics, or your child is taking a liquid antibiotic, make sure they brush their teeth after, because it can increase the chances of cavities. Anyways, that was that. I hope you learned some more about that. I'm going to be talking more specifically about specific antibiotics. So go ahead and watch that video, and I'll see you soon. Bye.